All right, it's football season, and we've got some of those kids going back playing football, and there's going to be some injuries, but there's some ways to prevent some of those injuries, and we've got an expert with us here today. We have got Dr. Josh Bell. How are you doing, doctor?
Great.
I want to make sure I get this right. You're a board-certified orthopedic surgeon.
That's correct.
With the Sports Institute and the San Antonio Orthopedic Group.
That's right.
Okay, it's a mouthful, but we got it right. All right, football season is going to be in full swing here very shortly, right?
Yep.
What is the best way to help to prevent injuries out there on the football field?
Well, obviously it starts kind of before the season starts, and that's really the conditioning that you might do and the physicals that people get prior to. The Xbox is not
right. The conditioning is very important these days. Unlike when I was a kid, we were outside all day long, all the time, and now you got a lot of the kids with the Xbox.
The thumbs are conditioned before football season starts, obviously, but we don't really need the thumbs conditioned with the Xbox. We need the stretching, we need the workouts prior to the season starting.
Right, so conditioning is very important.
Absolutely.
We've got safety equipment that is designed to keep us safe, but injuries do happen.
Absolutely. I mean, we brought a couple here. We brought a helmet. Obviously, concussion is a big focus nowadays. I mean, years ago, maybe in high school for me and you got your bell rung, and that was, you know, just kind of get back out there. That's not the case.
Yeah, for some reason, it just wasn't as important for us back in the day. They didn't care as much about it, I guess.
Maybe so.
But today, it's very important. How can you tell if somebody has a concussion?
Well, obviously, the signs of concussion altered, you know, people acting strange, losing consciousness even for a short amount of time, afterwards having symptoms like nausea or headaches that are recurring. Those are serious symptoms. It's a brain injury, and that's what we didn't recognize before that we recognize now.
All right, and you've got braces like the brace.
Absolutely.
Here.
Yeah, and so I mean there are lots of different braces. Certainly the most common injuries we see are low extremity injuries. So we see a lot of ankle sprains. An injury that we take care of a lot of as surgeons is an ACL injury, and this is an ACL brace, which is sometimes used afterwards. That's a common injury that we see, a twisting injury of a player. You heard about it in athletes, you know, from Jerry Rice had one all the way through to you know, Derrick Rose having one recently with the Chicago Bulls.
Right. You know, we're talking about concussions. We're talking about the braces, you know, injuries to the knees, torn ACLs, things like that. If you've got your kid out there and he's playing on the football field, how do you know if he's okay to go to play, or if, you know, put it this way, you know, say he's just complaining. How can you really tell the difference if he's complaining a little bit, but it's not a big deal, or something that is real injury?
Well, obviously, I mean, everybody knows their kid. There's some kids who, you know, going through different parts of their life, they're going to be a little more injury prone as they're growing quite a bit. But obviously, symptoms that linger, swelling that's associated, having it checked out is real important, whether that's by on the field people or a sports specialist.
Right. So you got to know your kid.
Absolutely, got to know your kid, and you got to have the proper support around them, whether they be trainers or going to a clinic like the Sports Institute.
Okay. Well, thanks a bunch. I know we've got a lot of kids out there playing, and beginning August 29th, you're going to have walk-ins, a walk-in sports injury clinic every Saturday during football season from 8 a.m. to 10 a.m. at the 400 Concord Plaza Drive.
That's correct.
That's excellent. And if you want more information, all you got to do is go to TSAOG.com or give them a call, 210-804-5400. Doctor, thank you so much for being with us today.
I appreciate it. Thank you.